Nephritis is a medical term used to describe inflammation of the kidneys, which can impair their ability to filter waste and excess fluids from the blood. The kidneys are vital organs responsible for maintaining fluid balance, regulating electrolytes, and removing toxins from the body. When inflammation occurs within the kidney tissues, particularly in the glomeruli or interstitial areas, it can lead to serious health complications if not treated properly. Nephritis is not a single disease but rather a group of disorders affecting different parts of the kidneys, and its causes, symptoms, and outcomes can vary widely. Types of nephritis. There are several forms of nephritis, each affecting the kidneys in a distinct way. Glomerulonephritis. This is the most common type and involves inflammation of the glomeruli, the tiny filtering units within the kidneys. It can occur suddenly, acute glomerulonephritis, or develop slowly over time, chronic glomerulonephritis. Acute forms often result from infections, while chronic cases are linked to autoimmune disorders or prolonged inflammation. Interstitial nephritis. This form affects the spaces between kidney tubules and surrounding tissues. It is often caused by allergic reactions to certain medications, such as antibiotics or nonsteroidal anti-inflammatory drugs, NSAIDs. Sometimes infections or autoimmune conditions can also trigger interstitial nephritis. Lupus nephritis. This occurs when systemic lupus erythematosus, SLE, an autoimmune disease, causes the immune system to attack the kidneys. It can lead to severe kidney damage if left untreated and is one of the most serious complications of lupus. Pyelonephritis. This type refers to bacterial infection of the kidneys, usually starting from the urinary tract and moving upward. Pyelonephritis can cause fever, flank pain, and frequent urination, and may become chronic if infections recur frequently. Causes and risk factors. The causes of nephritis vary depending on its type, but common contributing factors include infections. Streptococcal throat infections can trigger post-streptococcal glomerulonephritis, especially in children. Autoimmune diseases. Conditions like lupus, rheumatoid arthritis, and vasculitis can cause the immune system to attack kidney tissue. Medications. Long-term use of certain drugs, such as painkillers, antibiotics, or proton pump inhibitors, can lead to interstitial nephritis. Toxins and chemicals. Exposure to heavy metals or certain toxins can damage kidney tissue. Genetic factors. Some inherited disorders, such as Alport syndrome, can result in chronic nephritis. Other conditions, high blood pressure and diabetes can worsen kidney inflammation or make kidneys more susceptible to injury. Symptoms of nephritis. Symptoms depend on the severity and type of nephritis but commonly include swelling, edema, in the face, hands, feet, or abdomen due to fluid retention. Reduced urine output or changes in urine color, dark, foamy, or blood-tinged. Fatigue, weakness, or loss of appetite. High blood pressure, hypertension. Nausea and vomiting in advanced cases. Shortness of breath due to fluid accumulation in the lungs. Pain or tenderness in the kidney area, lower back or flank. In chronic nephritis, symptoms may appear gradually and be less noticeable until kidney function is significantly reduced. Diagnosis. Doctors diagnose nephritis through a combination of medical history, physical examination, and laboratory tests. Key diagnostic methods include urinalysis, detects protein, blood, or white cells in urine, indicating kidney inflammation. Blood tests, measure levels of waste products like creatinine and urea to evaluate kidney function. Imaging tests, ultrasound or CT scans can reveal structural abnormalities or swelling in the kidneys. Kidney biopsy, a small sample of kidney tissue is examined under a microscope to identify the exact type and cause of nephritis. Treatment options. Treatment depends on the cause and severity of the disease. The main goals are to reduce inflammation, manage symptoms, and prevent further kidney damage. Medication, corticosteroids and immunosuppressive drugs are often used to control inflammation and immune responses. Antibiotics, for bacterial infections like pyelonephritis. Blood pressure control, ACE inhibitors or ARBs help protect kidney function and reduce protein loss in urine. Dietary changes, reducing salt, protein, and potassium intake helps relieve kidney strain. Dialysis, in severe cases where kidneys fail to function properly, dialysis may be required to remove waste products from the blood. Kidney transplant, for patients with end-stage renal disease, transplantation may be the only long-term solution. Prevention and management. While some forms of nephritis cannot be fully prevented, several lifestyle measures can help reduce risk. Maintaining good hygiene to prevent infections. Managing autoimmune diseases effectively. Avoiding overuse of medications that may harm kidneys. Keeping blood pressure and blood sugar levels under control. Drinking sufficient water and maintaining a balanced diet. Conclusion. Nephritis is a serious condition that can affect the kidney's ability to perform their essential filtering functions. If left untreated, it can progress to chronic kidney disease or kidney failure. Early diagnosis, proper medical care, and lifestyle modifications play a vital role in managing this condition. With timely intervention and ongoing monitoring, many individuals with nephritis can lead healthy and productive lives.